Thank you all for being here. I did hear a lot of French, but I will do it in English. And if there are any questions, allez-y en français, y a pas de souci. Anyhow, happy to be here. And today we're going to talk a little bit about AI in healthcare. And it's a personal journey because when I started in healthcare a long time ago, 20 years ago, the next big thing was digitalization of healthcare. So the creation of data, like imaging data, patient record data, also genomics data, and getting already from analog into digital was already a big step. And now we're in the next step, which is really using all of data for doing intelligent things like AI. But AI is just a tool. Let's also be very clear on that one. It's one of the many tools that we have at our disposal, maybe, to really make healthcare a better place for the patients and the doctors. So question is, can AI really transform patient outcomes? What do we see in the market? What do I see happening in the market? Across all the different projects that I have been doing over the last 20 years within healthcare, and can we really see real outcomes that really are beneficial for doctors and patients within that space, with a little bit of focus on radiology because that's my major domain of expertise. Now, AI is multiple visions of AI, especially 10, 15 years ago when we were starting, we did see robots, we had all of these strange things about AI, now going more into, can I really have something like Alexia helping me out? Of course, we have been evolving way more than that. And today, if you really talk about AI, it really is the mimicking of human intelligence by machines. I don't have to explain the definition of AI within an AI conference. I'm sure everybody is understanding that. And if you talk about the AI goal, that is still not very sure and certain for me. Many people talk about better patient outcomes in terms of quality. And that's definitely one of the major goals that should be achieved and obtained. But there's also another angle, and that's really also about the productivity angle in AI. And just to make a little bit of the big picture here, drawing the big picture, in France, there's about 65 million medical imaging exams per year that are being performed. So one exam per citizen per year. There's about 5,000 to 6,000 radiologists in France. So any radiologist in France does an average productivity of about 10,000 exams per year, reading the exam and making a diagnosis. We expect that over the next 5 to 6 years, about 1,500 of these radiologists will go out. They will be going on pension, leaving basically the workforce. And at the same time, we're also expecting that within the next 5 years, people are getting older, people are getting more diseases, cancer, etc., that the 65 million exams will maybe become 75 million exams. But we will have a workforce of radiologists that will be maybe instead of 6,000, maybe only 5,000. So productivity gains are absolutely also a very essential part of the equation in making sure that AI can be deployed within healthcare, as much as the quality. In some countries, like I was a couple of weeks ago in England, there they have 4,000 radiologists for 60 million exams, and they're expecting that 1/3 of these radiologists will go on pension within the next 5 to 6 years. So who will read all of that medical data? Will AI replace a radiologist? Definitely not. But can we and should we try to use AI to improve at least also the productivity of the people that we have, fewer and fewer specialists that we have? Definitely, definitely yes. And we have seen a lot of evolution in AI. The classical machine learning, where you have pretty much features that are being defined by humans. Classical example, the price of a house based on location, the sizing of the house. It still is very understandable. The next generation of AI, which is now happening and which we see all over here, which is really, neural networks. And that's a little bit more difficult already to understand because we are training now machines. We are entering, for instance, masses of medical imaging data into such a machine and to such a neural network. We are demanding the machine to make a categorization, to provide an outcome. The machine is doing its magic in the interior, but can we really understand now what features have been used to also get to that result? So we're getting more into a black box type of discussion. And if you're talking then to medical professionals like radiologists, well, it's hard for them to understand. And because it's hard for them to understand, it's also hard for them to accept that this machine can help them. Because if it does something wrong and I don't understand why, it has been categorizing something as a false negative or a false positive, and I don't understand why, how can I accept that that machine will help me in doing my job? So there's a lot of cultural aspects that also come to play into the acceptance of AI as a remedy and as a tool to help the medical professionals to help the patients themselves. And of course, the generative AI that we all know with ChatGPT, which is the latest version. Now let's go a little bit back to radiology and AI. What do we see happening here? First, in terms of market acceptance, in terms of offering, it's huge. If you talk about the number of algorithms in medical and the medical space that are being built today, half of them are within radiology. Half of them, 50%. This is already 1.5 years old. I think for the moment there's probably already 100 plus, 200 plus AI algorithms that have a CE mark that can be used as a medical device and can help the medical imaging specialists out there. If you then go to the other side, the users, and this was taken by the NHS, so the National Health Service in England, there we see that, and I'm a little bit standing in the way here, but there the question was very simple. Do you think that within the next 5 years, you will be using AI as a tool to help you with your job? Job, being a radiologist. And there you see that within 5 years, almost everybody, this was about 120 respondents there, almost everybody, 82 plus 18, that's very positive or positive, was answering, yes, I will be using these algorithms to help me with my job. So man against machine, I think it's really going to be different. They're going to help out each other. Then the next question is if there's an industry demand, if the radiologists are really claiming that they would like to use these algorithms, then the next step is really how good are they? And of course, there's a lot of data out there, but I took a very recent Danish study that can help out. And it was a little bit man against machine. You did see 2,000 chest X-rays, medical images that need to be classified based on 3 diseases: airspace, pneumothorax, and pleural effusion. And basically what they did was they basically compared the reports of 72 radiologists in Denmark versus 4 AI algorithms. And then we're classifying the results based on the sensitivity and the specificity of the outcomes. And it's quite surprising, you know, because 80% sensitivity, that means that as well the 4 AI tools as the radiologists themselves were still missing on 20% of the cases. So we had 20% of false negatives within the whole study, which seems quite high. In terms of specificity, that's a little bit different. There you see that the radiologist only had 11% false positives, while the 4 different AI algorithms had anything between 14 and 38% of false positives. So looks like in terms of specificity that the radiologists were still doing a better job than the AI algorithms. But the radiologists had more information. They could call up priors, they could compare with the priors in order to make a much better, well-informed decision. And so one of the advices from the authors of the study, AI versus radiologists, was really, we have to also evolve into the doing deep learning, machine learning training with much more associated data, like, of course, for instance, these priors. Now, maybe also one of the other examples and lessons to take from that study is that not all AI algorithms are created equal, because if you, and there's no names of manufacturers here, which is not the case, but if you talk, for instance, about sensitivity, AI Venderay had a sensitivity of 72%, vendor B had a sensitivity of 91%. So what it also shows is that it really matters that if you want to deploy an AI algorithm for a certain categorization case that you have defined, you have to look at the market. You know, it's not everybody will go to 90%. There's a lot of difference between the different AI vendors. And it really matters to take a closer look, because the machine learning that has been done can be very dependent upon types of modalities, how you are dealing with the images, etc., and that can lead to big differences in terms of outcomes. So that's also one of the major lessons that I took from the report that was shown here. Now, let's go back again to the lessons from the authors and say more data is needed and more performance is needed. That's definitely true, because what we definitely want to have is we don't want to have a specificity and a sensitivity of 80%. We're going to go to 90, 95%. I think that's going to be the threshold that is required to really give all the medical specialists out there the confidence that the tool that they're going to choose and will start to use is really the tool that they need to be in confidence that it will increase either the productivity or either the quality of care that they will be providing for the patient. So we need much more data, and in the learning models also much more performance to do so. Now, we are Pure Storage. We don't develop AI algorithms, but we are basically one of the base pillars in terms of infrastructure to make these endeavors possible. And if we talk about data and performance, that's really where we're going to play. Now, one of the challenges that we see in AI development within the healthcare space is the explosion of data that you need. That will be even basically get worse if you want to go to very high levels of sensitivity and quality of the AI algorithms. And let's have a little look at the numbers. You know, medical imaging, 100 megabyte per exam. 65 million of them every year in France, probably 1 billion already produced somewhere in medical imaging archives in a digital format. Digital pathology, the next wave, a lot of AI also for digital pathology, starts to get digitized for the moment. Probably 10% of the hospitals have digital pathology, will grow to 80% within the next 5 years. And then the holy grail, the genome itself, really, you know, the 3 elements that you need to have to go to personalized medicine, seeing what is happening in the body, seeing what is happening on a cellular level, and really going in depth into the cell itself to look at the DNA of the cells. Those 3 data elements are really the fundamental pillars of the personalized medicine that everybody wants to achieve. 65 million exams a year, maybe 5 million, maybe 20,000. That is how you have to see it. If by 2030 we're going to do as much, or we're going to do, for instance, all the genome scanning of all the cancer patients, that will grow from 20,000 today to 400,000, 500,000 within 5 years. So if we only think about the fact that there's massive amounts of data for the moment in healthcare, think again. It's going to explode. It's going to go times 20, times 50, times 100 when all of these new use cases that are really required for personalized medicine are really going to be put into production at the scale that needs to be. And so one of the elements that we are bringing to the table is really the massification, the densification of the storage media. To put it in a very concrete example, with the newest flash modules that companies like us bring to the table, that bring capabilities and capacities on a very, very dense footprint to the industry, we now can, in a form factor of 3 use, which is like 27 centimeters, we can store 40 million exams today, which is about 2/3 of the annual production of medical imaging exams in France. We can store 4 million slides, which is about 20% of the annual production of histopathology slides in France if they were digitized, which is not yet the case. And we can store 40,000 full genomes, human genomes. Today, annually, there's about 20,000 full genomes that are being sequenced for the moment in France. But that can increase to 400,000 within the next 5 to 6 years. By 2026, we're going to have flash modules with 300 terabyte capacity, which means that on a little footprint, we will be able to store 160 million medical imaging exams, 20 million slides itself, and 160, there's a little typo there, and 160,000 full genomes. And it's fundamental increases in data capacity like that will enable the healthcare industry to cope with the challenges that they have in terms of data explosion. Data that then can be reused, not just for consumption by the specialists, but also consumption by computers to really build better models that can again increase then the quality and the productivity of these specialists. And then you go into a virtuous circle that will improve and start improving healthcare, of course, all over. Together, of course, with that element, we also have another characteristic which is very important. Flash, as a technology platform, is not just adding densification and capabilities in terms of capacity, it's also adding performance. Performance that will be absolutely needed to crunch through, read and write, consume all of these data by anybody, by machines like GPU, by people like specialists, like us as a patient. All of that will require way more performance of the data carriers that we are using today. And the combination of those two aspects will make sure that we can now build really big data hubs that can help to build algorithms, that can help to consume information by the specialists and by also the people that will be using that information outside and inside the hospital. And by having these technical capabilities, we will be able to contribute to simplify, uncomplicate, and accelerate the use of AI within data-driven healthcare, which will happen very soon. Thank you very much.
We do have a few moments to take questions, if anyone has any questions.
S'il y a des questions, n'hésitez pas. En tout cas, on est déjà là-bas, on a un stand là-bas, donc si vous avez des questions, n'hésitez pas à passer et on serait ravis de vous rencontrer de nouveau là-bas et de répondre à toutes vos questions. Merci beaucoup.
Merci.